Can telehealth doctors prescribe controlled substances? Have you ever wondered if telehealth doctors can prescribe controlled substances? This is a topic that many people are curious about, especially as telehealth becomes more popular. Let's break it down together. Telehealth doctors can indeed prescribe controlled substances, but there are specific rules to follow. Controlled substances are medications that the government regulates due to their potential for misuse. They are categorized into schedules, ranging from Schedule Roman II to Schedule V, based on their risk levels. As of 2025, federal regulations allow qualified healthcare practitioners registered with the Drug Enforcement Administration to prescribe these medications via telemedicine. This means that a prior in-person visit is not always necessary. This flexibility was first introduced during the COVID-19 public health emergency and has continued. However, there are important conditions that must be met. For starters, healthcare providers must use approved telemedicine platforms that allow for real-time audio-visual communication. In some cases, like prescribing buprenorphine for opioid use disorder, audio-only visits can be acceptable initially. Before prescribing, doctors need to check the patient's prescription history through state prescription drug monitoring programs. This helps ensure that the patient is not receiving multiple prescriptions from different providers. Additionally, healthcare providers must follow both federal and state laws. Some states may have extra restrictions or requiring special registrations to prescribe controlled substances via telehealth. In certain situations, a healthcare provider may need a special registration from the Drug Enforcement Administration that allows them to prescribe without an in-person visit. For mental health care, this means that psychiatrists and other specialists can manage medications for conditions like anxiety and depression remotely. This can improve access to care for many patients. Telemedicine platforms often integrate electronic health records and prescription monitoring to support safe prescribing practices. If you are considering a telehealth appointment for a controlled substance prescription, there are a few things to keep in mind. First, make sure your telehealth provider is authorized to prescribe controlled substances. Be prepared for a thorough evaluation, which may include discussing your medical history and any previous prescriptions. You should also be aware that follow-up appointments may be necessary, either through telehealth or in person, to continue receiving prescriptions. In summary, while telehealth expands access to controlled substance prescriptions, it is essential to follow legal and clinical guidelines. This ensures that patients receive safe and effective care while enjoying the convenience of telehealth services.